Hey friends, Olivia from Ollie. Between new routines and the ultimate group project known as parenting, you need science-backed solutions that work with your life. That's where Ollie comes in. Start your mornings off right with multis made to support nutrition and immune health. Choose from our lineup of gut-supporting probiotics, and we've got occasional sleep support to help the whole fam chase their big dreams. Head back to class with the #1 gummy supplement brand. Stock up on ollie.com today. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
This episode is brought to you by Facebook. So you were scrolling on Marketplace, and there it was, the bike you'd been searching for. You sent a message, and it turned out the seller was super chatty, kind of funny, and an avid cyclist. The next thing you know, you're in a cycling crew. Well, a community cycling group. The thing about Facebook, you might find more than what you're looking for. From a browse to a bike ride, this summer find more on Facebook.
Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 2 Questions podcast. In this episode, I'll be reading 3 more neurology questions from our online Qbank, and of course, you can read these questions and more at medprep2go.com. And now let's get started with question 1, Neurology 13. A 27-year-old woman presents to the urgent care clinic for evaluation of muscle weakness, excessive salivation, and diarrhea which started 1 hour ago. She was picking apples when her symptoms began, and she has never before experienced these symptoms. Past medical history is significant for endometriosis, for which she takes a combined oral contraceptive pill. Vital signs are significant for a heart rate of 45 beats per minute, and physical examination reveals diffuse weakness, wheezing, excessive salivation, and excessive lacrimation. Which of the following best describes the most likely mechanism of this patient's symptoms? Is it A, decreased receptor density at the neuromuscular junction, B, degeneration of anterior horn cells, C, demyelination in the central nervous system, D, demyelination of peripheral nerves, or E, excess neurotransmitter at the neuromuscular junction? And the correct answer is E, excess neurotransmitter at the neuromuscular junction. This patient is most likely experiencing organophosphate poisoning secondary to pesticide exposure from picking fruit. Organophosphates inhibit the enzyme acetylcholinesterase, resulting in excess acetylcholine activity and parasympathetic activation. This results in symptoms such as diarrhea, urination, meiosis or muscle weakness, bronchospasm, emesis, lacrimation, and salivation or sweating, commonly remembered by the mnemonic dumbbells. Treatment is with pralidoxime and atropine. Interchoice A, decreased receptor density at the neuromuscular junction, is incorrect. This describes myasthenia gravis, in which antibodies against the acetylcholine receptor at the neuromuscular junction lead to difficulty with muscle contraction. It often presents with ptosis as an initial symptom. Interchoice B, degeneration of anterior horn cells, is incorrect. This is the mechanism of amyotrophic lateral sclerosis, ALS, a progressive neurodegenerative disease that presents with upper and lower motor neuron signs. Interchoice C, demyelination in the central nervous system, is incorrect. This describes multiple sclerosis, an autoimmune condition that may present with episodes of vision impairment, often internuclear ophthalmoplegia, difficulty walking, and or sharp tingling sensations known as Lermit sign. Interchoice D, demyelination of peripheral nerves, is incorrect. This describes the mechanism of Guillain-Barré syndrome, which presents with gradual ascending weakness and paralysis. It usually occurs after infection, often Campylobacter, or vaccination. Key learning point. Organophosphates inhibit acetylcholinesterase and increase acetylcholine activity at the neuromuscular junction, resulting in excess parasympathetic activation. Question 2, Neurology 14. A 36-year-old man presents to the emergency department with a severe headache. He reports that 2 hours ago he began experiencing severe pain over his left forehead and around his left eye. He also reports a moderate amount of nasal discharge. The patient has had multiple similar hour-long episodes of left-sided headaches for the past 2 days. Past medical history is otherwise unremarkable, and he does not take any medications. He drinks 1 glass of wine on the weekend and does not use tobacco or any recreational drugs. Vital signs are temperature of 36.7 degrees Celsius or 98.1 degrees Fahrenheit, blood pressure of 129/76, a pulse of 122 beats per minute, and respirations of 16 per minute. On physical examination, the patient appears uncomfortable, rocking back and forth in his chair and rubbing his forehead. There is conjunctival infection and mild ptosis of the left eye. The left pupil is smaller than the right, and both pupils constrict equally to light. There is moderate watery nasal discharge. Examination of the cranial nerves is normal. Bilateral biceps and patellar reflexes are 2+. Strength and sensation are normal in all extremities. Which of the following is the most appropriate treatment for acute control of the patient's symptoms? Is it A, 100% oxygen, B, carbamazepine, C, gabapentin, D, ibuprofen, or E, verapamil? And the correct answer is A, 100% oxygen. This patient has findings consistent with the diagnosis of cluster headache. Cluster headache is a type of primary headache that is more common in men. Cluster headache presents as attacks of unilateral excruciating periorbital pain that lasts from 15 minutes to 3 hours and is usually associated with ipsilateral autonomic symptoms such as conjunctival infection, lacrimation, rhinorrhea, as well as with partial Horner syndrome, meaning ptosis and meiosis without anhidrosis. Cluster headaches tend to occur in episodes known as cluster periods, which are often followed by months of remission. The diagnosis of cluster headache is clinical. Only patients with red flag symptoms of headache, such as systemic symptoms, abnormal neurologic exam, signs of raised intracranial tension, or post-traumatic onset, require an MRI to rule out secondary headache. Acute treatment of cluster headache is with 100% oxygen therapy. Other first-line treatment options include subcutaneous sumatriptan or zolmitriptan nasal spray. For long-term prophylaxis, verapamil is the first-line treatment option, while lithium and topiramate are other options. Answer choice B, carbamazepine, is incorrect. Carbamazepine, an anti-epileptic sodium channel blocker, is the first-line treatment for trigeminal neuralgia. Trigeminal neuralgia presents as unilateral shooting pain in the distribution of the trigeminal nerve that characteristically intensifies with chewing, talking, or touching various areas of the face. Episodes usually last for seconds to minutes and may progressively increase in intensity and frequency. Carbamazepine is also used in the treatment of focal seizures, generalized tonic-clonic seizures, and bipolar disorder. Answer choice C, gabapentin, is incorrect. Gabapentin, an anti-epileptic calcium channel blocker, is primarily used for the treatment of peripheral neuropathy, neuropathic pain, and post-herpetic neuralgia. It also has other off-label uses, such as the treatment of alcohol withdrawal symptoms. Answer choice D, ibuprofen, is incorrect. Ibuprofen is a non-steroidal anti-inflammatory drug that exerts its analgesic, antipyretic, and anti-inflammatory effects by reversible inhibition of the cyclooxygenase enzymes. It is indicated for the symptomatic control of pain and fever in a variety of conditions. NSAIDs are a first-line treatment option for both migraine and tension headaches, but are ineffective for cluster headaches. Answer choice E, verapamil, is incorrect. Verapamil is a calcium channel blocker and is indicated for long-term prophylaxis of cluster headaches, but is not effective for acute control of symptoms. Other indications of verapamil include hypertension, angina pectoris, hypertrophic obstructive cardiomyopathy, and cardiac arrhythmias. Key learning point. Subtypes of primary headache include cluster, migraine, and tension headache. Cluster headaches present as episodic unilateral excruciating periorbital pain associated with ipsilateral autonomic symptoms, such as conjunctival infection, lacrimation, and rhinorrhea, as well as partial Horner syndrome, meaning ptosis and meiosis without anhidrosis. Acute treatment is with 100% oxygen or triptans. Verapamil is the first-line treatment option for long-term prophylaxis.
Your summer runs just got a boost of energy in Lululemon's Shake It Out shorts. Made in our ultra-breezy lightweight Swift fabric, the Shake It Out shorts have a flowy, layered hem and a comfy built-in liner. These shorts keep you locked in for miles with distraction-free storage and a waistband that doesn't budge. They might just be the shortcut to your summer goals. Shop the Shake It Out shorts now at Lululemon.com.
Plan B is a backup birth control option that's there for you when things don't go according to plan. It specifically works after unprotected sex and before pregnancy occurs by temporarily delaying ovulation. Plan B is available nationwide at all major retailers and through delivery apps like DoorDash. No ID, prescription, or age requirement. It's the #1 OBGYN recommended brand of emergency contraception, and it won't impact your future fertility. That's freedom to be. Use as directed.
Question 3, Neurology 15. A 68-year-old man is brought to the emergency department by his wife due to the sudden onset of right-sided weakness and difficulty speaking. His symptoms began approximately 6 hours ago. He has a history of type 2 diabetes mellitus and hyperlipidemia. His blood pressure is 210/115, heart rate is 88 beats per minute, and respirations are 16 per minute. Neurologic examination reveals a dense right-sided hemiparesis and expressive aphasia. A non-contrast CT scan of the head is negative for intracranial hemorrhage or early signs of large territory infarct. Which of the following is the most appropriate next step in the management of this patient's blood pressure? Is it A, aspirin and clinical monitoring, B, intravenous alteplase, C, intravenous labetalol, D, intravenous nicardipine, or E, oral lisinopril? And the correct answer here is A, aspirin and clinical monitoring. This patient is presenting with an acute ischemic stroke, AIS. Because the symptoms began 6 hours ago, he is outside of the standard 4.5-hour window for intravenous thrombolysis with alteplase. In patients with AIS who are not candidates for thrombolytic therapy, permissive hypertension is recommended. This involves withholding antihypertensive therapy unless the blood pressure is extreme, meaning systolic over 220 or diastolic greater than 120, or there is evidence of other end organ damage, such as aortic dissection, acute myocardial infarction, or heart failure. This patient's blood pressure of 210/115 does not meet the threshold for intervention. Maintaining a higher blood pressure helps maximize collateral blood flow to the ischemic penumbra, which is the salvageable brain tissue surrounding the core of the infarct. Aspirin is the appropriate immediate pharmacologic intervention for secondary prevention. Answer choice B, intravenous alteplase, is incorrect. The window for intravenous thrombolysis is generally within 3 to 4.5 hours of symptom onset. Since this patient's symptoms began 6 hours ago, the risks of hemorrhagic transformation outweigh the benefits of alteplase. Answer choice C, intravenous labetalol, is incorrect. While labetalol is a first-line agent for blood pressure control in acute stroke, it is not indicated here because the patient's blood pressure is below the 220/120 threshold for those not receiving thrombolytics. Lowering the blood pressure could potentially worsen the stroke by decreasing perfusion to the ischemic penumbra. Answer choice D, intravenous nicardipine, is incorrect. Like labetalol, nicardipine is a preferred agent for rapid blood pressure titration in stroke, but should be reserved for patients with a blood pressure greater than 220/120 or those undergoing thrombolysis with a blood pressure greater than 185/110. Answer choice E, oral lisinopril, is incorrect. ACE inhibitors are part of long-term secondary prevention of stroke, but they are not used in the acute management phase. Furthermore, oral medications are generally avoided in the hyperacute phase of stroke if there is a concern for dysphagia or if rapid titration of blood pressure is required. Key learning point. In the management of acute ischemic stroke, permissive hypertension is used to maintain cerebral perfusion to salvageable brain tissue. For patients who are not candidates for thrombolytic therapy, blood pressure should not be lowered unless it exceeds 220/120. For patients who are candidates for thrombolysis, the blood pressure must be maintained below 185/110. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read other Step 2 questions at medprep2go.com. Happy studying!